Okay, we're going to do a virtual demonstration of an oral gastric intubation. So for this, the patient should always be anesthetized. They should have IV fluids. There should be someone monitoring the anesthesia, and there should also be a nurse monitoring the overall procedure. Oral gastric tubes are commonly used for gastric lavage to remove gastric contents when emesis induction is unproductive or contradicted. So for example, when there's a high risk for aspiration ammonia with emesis induction, the airway should always be protected with an endotracheal tube. Again, the animal should always be under anesthesia, and this just provides safety for the procedure to be done and for the patient as well. So for some contradictions for gastric lavage are ingestion of corrosive agents, for example, bleach, batteries, different drain cleaners, ingestion of petroleum or hydrocarbons, and ingestion of any sharp objects. So we have two size tubes here. We have a bigger one that can be used for bigger breed dogs, and we have a smaller tube here. Again, this procedure is used for critical care patients and is not recommended when the patient is awake. So we're going to show the example on a smaller tube. So you would measure the tube from the tip of the patient's nose to the last rib, and then you usually put a marker. So I'm going to use a piece of tape to mark the tube, and this will act as the mark to show how far the tube should be inserted. So that's there. And then you should always lubricate the tube so it's easier inserted. So you're just going to insert the tube directly into the mouth, and then you would stop when this reaches the tip of the nose. And the patient should be in sternal recumbency in order for it to be easier to insert it. Some clinics do use the mouth gag, so they insert this roll of tape into the patient's mouth, and they insert the tube this way. That's not usually recommended, because it could cause some problems with the patient, and it could cause fluids or different things to be aspirated. And you also want to make sure when you insert the tube, you want to check to make sure that it's in the stomach. So one way to do that is you can do x-rays, because this tube will show up on radiographs, and you can tell if it's directly into the stomach. Another way would be some use a syringe to insert the air through the tube, but we have a drench pump here. So what we would do is we would put this on the end of the pump, and then we would be able to push air through it this way, and then you would take a stethoscope and listen if there are any bubbling or gurgling in the stomach, and that would show that you are in the correct spot. Also, if you were to give medications through this tube, you could take a small container, and you can actually put this pump directly into the container that has the medication, and you would be able to pump it up. So the medication would come from the container up through the pump and then go through the tube into the patient's stomach. You should always contact poison control to make sure what medications you should be administering to the patient based on the case that you're dealing with.